Hi, my name is Melanie. I'm 27 years old and I'm a survivor of sexual assault and sexual abuse from my childhood. When I was 12 years old, I was sexually assaulted by a 17-year-old, and when I was younger than that, I had repressed memories of being sexually abused by my babysitter's teenage sons when I was about 9 or 10 years old. I've been on this journey to healing for about 15 years, and there's been so much healing that has taken place, but I think the last part of my journey has been the most eye-opening and the most difficult, and I'm really looking forward to sharing with you some things that I've learned in the past year. Like I said, I'm 27 now, but I've been on this healing journey since I was essentially 12 years old, and so many other pieces of the journey were something that kind of happened for me. I mean, I'm really fortunate to be where I am today, and I've been able to use my story to empower others. I work in the field now as an advocate, and there are so many things that I've learned in these past 15 years, but something that I wasn't so aware of that would still be impacting me today is the physical ramifications of sexual assault and sexual abuse. Like I said, I've done a lot of healing. I spent years in therapy. I found my voice a long time ago at a child advocacy center, and during that time I did have a medical exam. I did have a sexual assault nurse examiner check me out when I was 12 years old, when my case got kind of brought to the forefront, and that was an experience I don't really remember, honestly. And then the only other time I remember getting checked out medically was when I was about 17. I decided that I really wanted to kind of take a grip onto my healing even deeper, and I wanted to try to step into the world of gynecology. I wanted to make an appointment and to be seen by a gynecologist. My mom recommended the one that she currently sees, and I went for the first time, and it wasn't her fault, but I was completely re-traumatized. I didn't really know what to expect. I felt like things were moving too fast, and I just couldn't do it. I had sat down on the table, and she didn't even really come near me with anything. I just started to freak out, essentially, and I had a really hard time, and I ended up leaving there that day and not being completely seen, and there was no exam. So that was about 10 years ago now, and I swore I'd never go back, and I'd never go to the gynecologist. I had no plans of going. And then when I was about 2 years ago, I had experienced a pretty significant physical injury due to an accident that I was in, and I ended up really paying attention to my body, and it was almost like there was something kind of left unsaid. And so as I was paying attention to my body a lot with my physical injuries, I kind of had this thought in the back of my mind, like I knew something had been wrong for a long, long time. I've always struggled with being able to use a tampon. I've always felt extreme pain when I've tried. I've had friends try to walk me through it, and I've had different people in my life try to encourage me that, they haven't been able to use them either, and they don't have a similar experience. So a lot of people are trying to help, but I just felt this deep need to get it looked at and to be empowered to get it checked out, and I didn't do that for 10 years. And even I've known since I was like 14 years old, or even before that something wasn't right, that something had happened as a result of my sexual assaults, and for me internally. And so I, after this kind of crash that I was in, that kind of made me pay attention to my body, I really started to look at this thing that I'd been avoiding for years. And so throughout my appointments, I established some rapport with an amazing primary care physician office, and I only see the PA there. I was recommended to see a PA at my primary care office, a woman who also has a specialty in gynecology. And for the past year, we have been working really hard to get me to a place where I can endure well woman exams, and it's been such a process. And so I just wanted to come on here and share with you some of the things that have helped me really heal the past year. There's been so many things that I've been able to accomplish, to find victory in, and it's been a really empowering experience. And so what I would say, I guess I'll start by answering the question of what would I tell people about sexual violence? Well, as you can hear from my story, that healing is not linear. And so, you know, I've been on this journey for a long time, and some people may think, even medical professionals may think that because it's been so long that I don't struggle anymore. And that is not the case. I have kind of turned it around and brought my pain to a purpose. I work as an advocate in the field now, and I have for the past 5 years, but there are things that I still deal with, and there are things that survivors deal with at every milestone in their life. And this is the thing that I feel like has the most shame and silence around it. Even, you know, for survivors who speak out about abuse, I'm only speaking from my experience. I speak a lot about my story, but this is something I never talked about, the physical ramifications of sexual violence. And, you know, it was detected years ago, you know, so I, through my process of healing, I had requested my records from my case. My case did go to trial, so there was record of the medical exam that took place, and I remember having an okay experience with the SANE nurse, the sexual assault nurse examiner, and she was one of the best in the state that I was living in at the time, and she's still one of the best. But what I did notice is that there was a note about something, some scar tissue or something like that in the paperwork. But they had thought, I think, from what my mom was telling me about it, again, I was 12 years old, so I just got these records a couple years ago as a process of my healing. But I did get the records as an adult, and also as a professional in the field. I was actually curious about my perspective now, this many years down the road, about the journey that I went on, and even the medical piece as well, because I've always known that something wasn't right. And so I looked back at the medical records, and it did say that there was some type of scar tissue that was found, but so I asked my mom about it, and she said that she does remember them telling her something like that at the time, but that she wasn't, they were confident that as my body grew, it would kind of heal itself, because the physical body is such an amazing thing, and it can heal itself in a lot of ways. You know, we get a scar on our hand and it heals up. So I think it was well-intentioned that everything would have gone that way, but my body just decided not to. So for years I've had this kind of scar tissue in the way. You know, when I've been trying to use a tampon, it is excruciating. I've felt just tense there for years, and I knew that it had to do with the trauma, but I felt like I had done so much work on my healing journey that it was extremely frustrating to still feel like something was holding me back. And so I've actually avoided intimacy for years. I've really struggled to reclaim that peace. I think partly, honestly, you know, for years I thought it might have been the emotional fears or the insecurity or my story itself. But honestly, I really think the underlying issue here has been my fear of what was actually wrong with me. You know, what was going on internally inside my body, that I felt this tensity, I felt this presence of something that wasn't right. And so in the past year, my doctor has been incredible with me, and I just want to share some things that you know, that have really helped me. And I would also say that the process, although it may seem, as a medical professional, I'm sure that, you know, you see hundreds and hundreds of patients, or if you're a student, you're going to see hundreds and hundreds of patients. And I know that you have a window of time when you see patients. But what I can say has been most valuable for me in the past year is that my doctor has the ability, I know this isn't possible for everyone, but she has the ability, so usually there's like a 15 to 30 minute appointment window for each patient, and she has actually taken over an hour and a half to 2 hours with me to walk me through this process, because it has been re-traumatizing, and it has been really difficult to face something that I put on the back burner for years. And so I've really been able to walk through this process with her. I am a woman of faith, so my faith has been at the forefront of this whole thing. She asked me to pray before. We take a minute and let me listen to some worship music before and during appointments. You know, the physical pain that I feel every time I have a well woman exam is something that I can't really describe, but it's pretty horrible. I mean, I was, really nauseous. The anticipation for these appointments were really, really difficult emotionally and physically. My body was almost kind of revolting is how I would describe it, to this process. And we got to a point where she actually knows my body as well as I do now. And it's so amazing that she did actually confirm and feel exactly what I've known for years, or known for the past few years and have felt for many years since I was a young girl, in the aftermath of sexual assault. And she has actually affirmed to me that she does feel that scar tissue that was, kind of left from many years ago. But we've been able to kind of work through that. So I've actually had a successful pap smear, a successful bimanual exam with her hands. I've had a successful internal ultrasound. I went to go get that as well after, just to see what else was going on. And so since then, we've really been able to kind of build this rapport. She knows where the pain is, and so she can walk me through. We've been able to actually break through the pain, so she hits the painful spot with her hands or with a speculum, and she's able to kind of get me to relax my body enough that kind of scar tissue, instead of becoming a wall, actually kind of moves to the side. And so that's just a testament to the work that we've been able to do as a patient and a doctor. As a gynecologist, she's taken something that could have been so re-traumatizing, and although it was initially, she took the time and she made the effort to meet me where I was at every single moment. And that prolonging of appointments was so crucial. It took me 6 months to even be able to have a speculum enter all the way. And that was something so victorious for me the day that happened. And she was able to celebrate with me, which I think is super important, that she kind of met me where I was at through the process. She honored the pain that essentially she was causing by doing the exam, but she also kind of met me where I was at and was able to, I'm going to pause there. She was able to really walk with me hand in hand, and slow down when I needed to slow down. Something else that I really struggled with, and this is something else to know about sexual violence, is that as survivors, we are often really good at dissociating or leaving the room, is what they call it. And for the first 6 months, I was completely leaving the room, and she could actually tell before I could say anything, because what happens with dissociation is you actually almost go out of your body. And so that was my survival skill when I was being sexually abused and sexually assaulted. And so naturally, as a coping skill, it carried into this experience as well, because my body was reacting to something that it thought was traumatizing, which it wasn't. But we have to retrain our brains and bodies as survivors to respond to things in a positive way. And that's why I think one of the reasons why I think intimacy is so hard for survivors, because that is the exact thing that was robbed from us, was used in violence, was taken before we even knew what it was. And so I think it's really important just to know that you've got to meet your patient where they're at, and if they have to go slow, and the progression of appointments was, maybe we just have her hands on the outside of my vaginal area, and then she would try to insert one finger, and then maybe two, and then she would try to use the speculum, and then she'd pull back and go back to one finger, then two. So it was really a progression of being able to meet the demand of that exam, and to be able to let my brain and body trust her. So that was really powerful for me, to have her literally walk with me every step of the way and to celebrate with me when that victory did come. And so I've talked a little bit about kind of re-traumatization. That was something that was obviously very present for me from the beginning, but her just talking to me and asking me if I was in the room was really, really helpful. That her voice and her words trying to get me to come kind of back off the ceiling and to be present for the exam, and for her to read it. And so when I couldn't speak sometimes, when I was kind of traveling outside of my body and just trying to get through it, she would actually start to take her hands away from my body in a very slow way. And so she was able to kind of meet my body where it was at and really be able to walk me through that and to be able to get me to that victory. And I really believe that that was part of it. So, and then I would say my overall experience that has been really helpful, even more recently, I would say I'm going to reflect on my current situation. So it's been about a year since I started this process, and as a result of multiple exams, an internal ultrasound, it's been found that I have pretty significant pelvic floor dysfunction as a result of possibly this injury, but also from the trauma and from, you know, being not able to insert a tampon for years. So my body just kind of went into protection mode. And so I do have a quote unquote diagnosis of vaginismus and vulvodynia, which are both, as you may know, kind of symptoms of pelvic floor dysfunction. And so it's been super healing to walk through this process now. I'm actually 3 weeks in now to a series of pelvic floor physical therapy appointments. I go twice a week, and the woman who I've been working with has been absolutely healing me literally from the inside out. I feel like, although it is excruciating, the pain sometimes because of that kind of wall that this scar tissue has caused, and because of the tensity in my pelvic region, and also I have the injury from the previous accident that I was in. And so I have really experienced like a whole pelvic dysfunction situation here. And this is kind of the underlying, like, my back hasn't been healing. And so I've been frustrated with the process because I've made it so far emotionally, physically. And again, back to that, healing is not linear. That's something hard to grasp onto when you've done so much healing. And so this is the final piece. And the woman that I'm working with, who's a pelvic floor physical therapist, she's a specialist, she's a manager of her practice. She decided she was working for a physical therapist, and she decided that the demand for this and the need for this, for women to know that they can go and get help for this, was skyrocketing. And I didn't even know this existed. And I was reading an article yesterday about pelvic floor PT, and the title of the article is, I thought my body was broken before I tried it. And that couldn't sum up things more for me, that before I found this physical healing that I've been looking for so many years, I felt like I've been in a place of pause on my journey, and not in necessarily a bad way. I've been in a place of pause where I'm physically struggling, but emotionally, spiritually, advocacy-wise, I'm literally thriving. And so I found my voice so many years ago. I do a lot of public speaking about my story, but this has felt like the missing piece for as long as I can remember. And the pain of that missing piece of healing has just continued to get deeper and deeper and deeper. And so I think what I would say is that really empowering people to seek assistance for this. So if you are not a gynecologist, or if you do not specialize in PT, pelvic floor PT, or you don't know about it, I would say educate yourselves on it, because it really has, in 3 short weeks, it has literally shifted my perspective on this whole thing. For the first time in my entire life, I have hope for my future. I have always been concerned about intimacy, pregnancy, intimate relationships, sex, all of those things that all survivors deal with at some point on their journey, and or they don't deal with it, and they're, and not that it's a bad thing, because I really believe that I was brought to this in the time that I'm able to handle it. I think the timing is perfect, but I also know that, so many of us sit here in silence about these things for years, and I've literally known that something hasn't been right since I was like 13 years old, and I'm just now facing it and walking through it. And it's been extremely painful. I've gone through a grieving process of the years lost to feeling like this, and I think just meeting survivors where they're at is so important. And so this process has been really healing and has given me so much hope for my now and for my future. It has given me a sense of control over my body that I've never had before, even in all of my healing. I have found a new sense of purpose that I want to help other women, and I want to open people's eyes to this kind of unsaid topic within the world of sexual violence, that the crimes that were committed against us go beyond our stories. They go deep into our soul, they go deep into our bodies, and our bodies are just trying to protect us, but sometimes that can cause some additional problems for us, down the road as we walk into, if we were children, as we walk into adulthood, and even longer than that. I mean, we all know that survivors of sexual violence don't always have the opportunity to share their story, and I am very fortunate that I have, but I also feel like I've been walking this kind of difficult road with this other piece that even with all the healing, all the support that I received, this was the untouchable. And so I've written a few blogs about this as well, and what I've called it is uncharted territory. And that's really what it's been, that I've walked down so many roads of healing, and this is just the one that felt the heaviest. And I think that's important to know, that physically we were hurt in some way when we were sexually assaulted, but mentally and emotionally we were also put through some type of pain. But I can say that the mental and emotional journey that I've been on for over 15 years feels like almost nothing now that I've walked through this like physical battle. And it's been so incredibly amazing that this woman does this full time, and she gives women their life back and gives children, gives women hope for that young girl that they once were. And she's really walked with me through these past 3 weeks. It's February 2019, and for the past 3 weeks I've been going into an office 2 times a week, and it's literally physical therapy for my pelvic floor. So it's about a 30-minute appointment if you're not familiar, and she literally does a bimanual exam initially, and then she literally has her hand inside my body for about 30 minutes, and each week, twice a week. And what she's doing, she's explained it to me. It's been incredibly healing to learn about my body in such an intimate way. The first appointment, she sat down with me. The second I sat down in the chair, I started to cry, and she got closer to me. She gave me her full and undivided attention, and she said, "We're gonna get you through this." And that, without her even knowing, without me even saying a word, was so profound for me. And then she asked me to tell her a little bit about my history, and she had really a mindset of like, I'm in this with you. And so she literally brought over a diagram, like live model of pelvis, and she explained to me why maybe my back isn't healing, because this underlying issue has been so much there for over 15 years. She validated my fears. She validated my goals, that I want to be able to be in an intimate relationship. She said, I have a box of tissues here at my desk, and I have a box of tissues near the table for a reason. She gave me she showed me the safety in that it's okay to cry through this process. And even though I'm a strong survivor, that this doesn't make me less of a strong survivor. It just makes me that much stronger to walk through this so that I can be the lighthouse for other women. I love the quote where it says, we share our scars so that we can be the lighthouse for other women or other people who are heading towards the same rocks that we hit. So my goal for sharing all of this with you is to really open your eyes to what it's like to be a survivor who's healed so much, but has this could actually be, and I haven't talked to many other people but who've experienced this piece, but I'm sure there are so many survivors out there that have experienced this piece or haven't even been able to go there yet. And it's really difficult to open this box. It does feel like Pandora's box because I've been on this healing journey for so long that I've kind of closed the door to a lot of the difficult memories, the difficult things that I remember physically that happened, the emotions attached to what happened to me. But this kind of really reopened a lot of things, but in a different way, in a way of victory, in a way of hope, in a way of possibility for my future. And that has been something huge for me that I've learned through this process, that although people would tell me for years that it's possible you can be intimate with someone one day without thinking about your abuse, I think I could believe them on the surface because I've done so much healing. I've shared my story on, smaller groups and stages across the US, and I've really jumped into advocacy. I work as an advocate now, but I never really truly deep down physically believed them because I've known for years that something wasn't right. And so empowering myself and empowering others to speak up, to ask the hard questions, to walk into your doctor's office and say, I need someone to help me with this, and to advocate for yourself. And so if someone's trying to advocate for themselves, just listen first and just be there every step of the way. Hold their hand if they need more hand holding. I know I needed that in the beginning. And meet them where they're at. If they like to listen to music, let them listen to music during an exam. If they like to pray, if they have a faith background, let them pray, or even pray with them. My doctor did that with me, and that was so profound. And just, meet them where they're at. My pelvic floor physical therapist has just been, I've had some hard questions for her, and I've been really up and down. It's been really victorious some days, and it's been really difficult others, but it's just been so amazing to walk through this process and to know that I have the reins now for the first time in my life. I have the full reins. I felt like I reclaimed so much of my life and my story, but this is a piece that I still felt like I didn't have control over because I didn't even have any answers to what was going on inside my body. And so now that I'm learning, I'm being educated. Educate your patients about their body. That has been super healing for me, to just know what's going on and to let them know every step of the way what you're doing. If something's going to be cold, warn them. Those little things mean so much, and the little seeds you plant of hope, and the little things are the big things that you can do to make especially survivors of sexual violence comfortable in your practice when you're doing these things that are super intimate. I mean, as survivors, that is the exact thing that was taken from us. That's the exact thing that was the body parts that were involved in the most horrible thing that's ever happened to us in our lives. So I think just giving us complete control in the room and just, letting us take a minute to breathe. And I remember in my early appointments, I really struggled. I was like nauseous and dizzy and felt like I was going to throw up, and I would have to like stay and recover in the office for a while. And so just giving us that space to walk through this healing journey is so, so important. And sometimes all we need for you is to just listen and to validate us and to, give us hope that you're gonna do everything in your power to get us through whatever it may be, but especially the physical exams. And, if there is something found, like, for me, it was that scar tissue that was found, and the severe pelvic floor dysfunction. If there is something negative found that, I had some idea that something wasn't right, but I know that a lot of survivors may not know if they are hurt internally, or if there's something that isn't working right. So I would just say deliver that gently and ask them if they have any questions, and give us time to process the information, because I know that was hard for me as well, even though I knew something wasn't right. And even after my first series of appointments for 6 months, where my doctor validated that what I was feeling there was something there. Even after that, even at times still, I have a hard time wrapping my head around that after 15 years, there's still something that has been left from the past, that there's evidence that remains. And so I think just delivering messages gently and just walking with us every step of the way is super important. So I thank you for your time. I thank you for all you do. And as a survivor, I just hope and pray that you'll take our words and put them into practice. Thank you.